Hey, good people. This week in our reading in our chapter, we're going to be talking about issues and concerns that may come about as you practice as a helping professional. So the very first place we're going to start out in talking is talking about how we develop a counseling style. Now, when we talk about our counseling style or a therapeutic style that we're going to be following, it is very, very important, good people, that you identify a therapeutic perspective that you're going to be following. The reason why you're going to develop or identify a therapeutic style or a theoretical perspective that you're going to be counseling from is not so much that it's going to be providing this strict regimen of what you're going to do, but it's going to lay the foundation for you that you can work with your client, consumer, or patient in helping them to reach a place of resolution and identifying goals, strengths, weaknesses, and all that good stuff that comes along with working with a client in a therapeutic setting. Again, when we talk about developing that counseling style, the whole idea behind it is not to be so regimented with this is how Piaget said to do it. This is what Freud said to do. This is what Maslow said to do. But the whole idea behind our theoretical orientation, again, is just to lay the foundation so that we know what we're building off of, that we're not just kind of like cherry picking in the nighttime, but that we have an idea about what it is we want to accomplish and how we're going to get to that end result with our client, consumer, or patient. When we talk about our responsibility in a therapeutic perspective, one of the responsibilities that we have in a therapeutic context with our client, consumer, patient is all about developing that relationship, a working relationship with them, a relationship in which we're agreeing to work towards an expected end. And that expected end is going to be whatever the goal is that client identifies for themselves. Also, some of the things we look at when we're talking about our responsibility in the therapeutic practice is we're looking at this thing that is the key to our success, good people: documentation, documentation, documentation. We have to make sure that we are maintaining adequate records for our clients, consumers, or patient. That falls in the realm of case management. That's something that is required, first of all, for insurance purposes, also required when we're talking about the client, just sharing information with you in regards to what their goals may be. It also provides a roadmap for you, the helping professional, to see the progress that's being made, what some hindrances or barriers may be. So it's very important that we understand those things when we're looking at a therapeutic relationship. When we're talking about that therapeutic relationship, we have to have this understanding that the goals that are created for our client, consumer, or patient, they are all created by that individual, by that person. It is not important for the goals of the counseling session to be all focused around you, the therapist. But the goal of the counseling session is to reach a place of, like I said before, a place of resolution for our client, consumer, or patient, that they can identify the place where they were, where they started when they first came to see you, and now the place where they have ended. And getting to this place of, I see now that I am empowered, that I have the tools that are necessary to make it through whatever this issue is that presented itself initially for me. Excuse me, when we talk about working through the counseling process, we have to be mindful that we are not just here for our clients, consumers, or patients to be a sounding board, that we sit and that we receive all their information. We also have a responsibility to provide an educational format or an educational element in the therapeutic process. And by education, I'm not talking about that we're teaching them A, B, C, and 1, 2, 3, but just educating our client, consumer, and patient on various issues as it pertains to the issue that they're bringing to the table, as it pertains to them working through their goals. So education may come in terms of talking about resources and referrals. It may be talking about new tools. It may talk about relaxation techniques, things like that. But your goal is always to provide your client with a roadmap to success. All right. So as we move on throughout this chapter, one of the things we also talk about is the techniques in counseling. Now, when we talk about our techniques in the helping profession, it is very important that we have an understanding of the value of our words, but also of nonverbal communication. So when we're looking at some of our techniques, sometimes we may get to a place where we allow the client to do all the talking. Sometimes we have to get to a place where we mirror what they say, or we have paraphrasing of what they say. We summarize what they say. Some of that active listening, and that may be a buzzword that you have heard throughout your educational journey. But when we talk about that active listening, that is one of the key techniques in getting to a place where we allow our client, consumer, patient to really talk about what their issues may be. Your goal is to provide a roadmap for them, not to allow them to go off on a tangent, so to speak, but to provide some direction as they're talking. Your input into their conversation is just guiding the direction, so that the information that they're giving you is information you can use to help build their goal sheet or their treatment plan. Okay, as we talk about our counseling techniques and the work that we do in the helping profession, I want to get to this part where we're looking at how we do an assessment and diagnosis as a helping professional. Now, let me just jump down real quickly to diagnosis. And this is in your textbook, giving us the definitions and everything. And when it talks about a diagnosis, it says here, diagnosis, which is sometimes part of the assessment process, consists of possibly identifying a specific mental disorder based on a pattern of symptoms that leads to a specific diagnosis. We have to understand one thing. I need you to understand this, good people. Hold on to it, latch on to it, make it part of your being. You will not have the credentials to diagnose anyone unless you become, I should say, a licensed clinical professional. If you are not licensed, you cannot diagnose. You can do a clear assessment, the very first thing that's on this slide. An assessment is that you are taking all the information in that your client, consumer, or patient may be talking with you about, listening to all of the relevant factors that they've given to you, and you are making in your mind an idea, a diagram of how these pieces fit together. With the assessment, they're giving you everything, a big bundle of stuff. And your job is to kind of decipher and analyze this information that they give you and figure out what pieces go together, how does it work together, and how is it impacting the client, consumer, patient as they come here and sit here with the problem that they present to you. So an assessment is something that you definitely will have the credentials to do, something that you have the skills to do. A diagnosis you cannot give unless you are a licensed clinical professional. So I want to make sure that I make that clear. When you give your assessment, and let me say this, when you give your assessment, sometimes you may receive information from an outside agency or organization that the client, consumer, or patient may have received services from. And in that information, there may be listed a diagnosis given to that client, consumer, or patient. You definitely can utilize that information in the treatment that you give to them. However, you cannot provide a new or updated diagnosis. That diagnosis that is given to them, one of the tools that's used in helping to pull together a diagnosis from symptoms that may be presented, from behavior that may be presented, is called a DSM, the Diagnostic Statistical Manual. This DSM, which is published by the American Psychological Association. The purpose of it is to provide information, to provide detailed information on symptoms, assessment, and possible diagnosis of some mental health disorders. Now, with our DSM, the purpose of the DSM is to provide that key, that breakdown. When we look at a psychological diagnosis or a psychodiagnosis, as our book refers to it as. But also when we're looking at differential diagnosis, trying to figure out and find the balance or find the correct diagnosis of this symptom versus this symptom, this diagnosis versus this diagnosis, which one is our client, consumer, or patient presenting with. The DSM is also a very useful tool within the helping profession, as a lot of the codes that are in the DSM are used with our managed care system when we talk about submitting payment information, submitting treatment information. So it's very important that we know about and know how to use the DSM, but a DSM we are not using, again, to provide a diagnosis. So I want to make sure that I make that very clear. When we talk about, in the very beginning, identifying your theoretical perspective so that you know what foundation you're working with, our book gives us a lot of introductory and just brief basic information on several theoretical perspectives. Psychoanalytic, we know that comes from Sigmund Freud. We know that also comes from Jean Piaget. The whole idea of we're looking at again, the psychological perspective, the thought process behind why someone does what they do. We have the Adlerian theory perspective that comes from Alfred Adler. We're looking at, again, examining different information as is comprised by the client, their behavior, and their environment. All of these theoretical perspectives, again, they're provided for you. A brief overview is provided for you in your textbook. So please make sure that you read over this. When we jump down to person-centered therapy, this is very important, especially when we talk about working with substance recovery, when we're talking about working with behavioral problems with our children and youth. Person-centered therapy, we're looking specifically at what is going on for the individual, for our client, consumer, or patient, and we're focusing on the whole person, the environment included. So when we're talking about person-centered therapy, we're looking at it from a micro perspective, that's the person. The meso perspective, that's going to be some of the support systems, some of the formal and informal organizations. And from the macro perspective, that's going to be society as a whole, the community as a whole. So that's something that you want to definitely do a little bit more research on. The cognitive behavioral therapy, again, our behavior. How is our behavior dictated, first of all, by the person themselves, but also the environment that they are functioning in? So all of these theoretical perspectives, I encourage you to read over them in the textbook, but more importantly, do a little bit more research on them so that you're familiar with all the ins and outs of the theories that are presented before you. A great class for you to take, if you have not taken the class already, is general psychology. General psychology will open up for you a lot of the information on these theoretical perspectives and give you a good foundation of them so that you have an idea of how you want to build your background or your foundation in working as a helping professional. Now, as I started talking a little bit about the DSM, I want to go back there again a little bit and just go over the DSM so we have an understanding about the use of this manual that's presented before us. Now, the DSM has gone through significant change over the past few years, in that it used to have the diagnosis was built off of 5 different axi or axes. I think it's axi, that's the plural. But they have done away with the axis, and so it is now built specifically on the parameters that you see on your screen: developmental issues, gaps in the current services, disability or an impairment, neuroscience, and cross-cultural issues. So when we talk about looking at the DSM, this is a very useful tool for helping professionals, first of all, in understanding how all these pieces kind of connect together to create a diagnosis, but also we utilize that, like I said before, when we're looking at billing for insurance purposes. We're looking at trying to give specific direction or an idea of what a plausible outcome may be for a client, consumer, or patient based on their diagnosis. Also, when we're looking at the DSM, some of the things that we have to be mindful of is when we're working with our client, consumer, or patient, we are given a very specific framework of what this diagnosis may look like. Now, hear what I'm saying, good people. When we look at this framework is not the end all to be all. It is not going to be something that is going to give us the end result for our client, consumer, or patient. It is just given to us as a guide. When we're looking at, again, our whole idea, I'm sorry, I went ahead too far. Our whole idea of working with the DSM, we want to make sure that we are utilizing that resource exactly what the purpose is for, what the purpose is of it, and that is to give us understanding of a person's behavior, or just to give us the foundation, the foundational aspect of a behavior. And as we continue to work with our client, consumer, or patient, we'll be able to develop a better understanding of their behavior based on their environment, not just on, again, this diagnosis that was given to them, but we got to work with the whole person. So we're looking at everything about that person, the diagnosis, their behavior, the environment, but also systematically what they may be working with or what they may be dealing with. So the DSM is a very important tool that we have as helping professionals. Now, one of the other things, or the last thing that I believe that our textbook is going to talk about, is our case for psychodiagnosis, or psychosocial diagnosis. When we're talking about psychosocial diagnosis, excuse me, we're looking at assessing our client based on the behavior that's presented before us, and looking at this so that we can get an understanding, first of all, of how this client, consumer, or patient is functioning within their environment. Are they presenting as a danger to themselves or to anybody else? And also we need to look at how are we going to, after we do our assessment, how are we going to format or formulate a treatment plan or a goal plan for our client, consumer, or patient. When we're talking about this psychodiagnosis, we have to be sure that when we're working with our client, consumer, or patient, that we are following as closely as we can a treatment plan that we have created for them, and that we are doing so based on our credentials, not based on what someone thinks that we ought to be doing, but based on our credentials. And we just have to really be mindful of that. Important that we follow and that we utilize the DSM, not so much as the guide for how to provide treatment, but just to be mindful of some of the symptoms that may come along with a specified diagnosis. Again, not one that we give, but one that may be documented in their records, may be given by a licensed clinical therapist or licensed clinical practitioner. When we get towards the end of the chapter, we begin to talk about some ethical and legal issues and making a diagnosis. Now, some of the things that we have to talk about and we have to make sure that we have an understanding of is, again, when we see someone with a diagnosis on their chart, we need to ensure that that diagnosis has been made, as I said previously, and I'll continue to say it, by a licensed clinical professional. There are people who may function with the idea that they have the authority and the ability to make a diagnosis because of alphabet soup behind their name, but they may not have the appropriate credentials, the licensing credentials to make that diagnosis. So sometimes we've got to be mindful of what's written in a client's chart and ensure ourselves and our clients as well that this diagnosis was given by a licensed professional. When we talk about using our clinical diagnosis, it is important that we look at the that we look at the diagnosis and not look at the person. I should say that we see the person and not see the diagnosis as the definition of the person. When we look at the diagnosis is just something that gives a name to the specific behavior or the symptoms that someone may have been presenting with. The diagnosis is not the problem. And I say that because we have to be mindful that some of the information that is provided for us, helping professionals, is not coming from a place that cultural awareness is taken into consideration. So when we get to the issue of cultural awareness or cultural sensitivity in the area of diagnosis, we have to know that, again, we're looking at the whole person, and we want to make sure that our client, consumer, or patient is not misdiagnosed, is not inappropriately diagnosed just because it may have been beneficial at one point for a service that they were receiving. When we talk about cultural issues in diagnosis and assessment, we have to present ourselves in a position where we are first of all, we're knowledgeable of the environment that our client, consumer, patient may be functioning in, or that they may be coming to us in, but also that we are open to receiving information to be teachable about the client, consumer, or patient's environment that they may be functioning in, so that when we are making our assessment, that we present ourselves as not so much a know-it-all, but help me to help you by gaining an understanding of the environment that you're working within, so that I can become culturally sensitive about what exactly is going on for this client, consumer, or patient. When we talk about cultural sensitive issues or cultural awareness, we're not just talking about issues pertaining to race or ethnicity. Be mindful, good people, that when we talk about culturally sensitive issues, we're talking about working with any population of folks who have been marginalized, who have been oppressed, who are feeling as if that there is that the equity is not there for them, that social justice issues still continue to be a problem or a hurdle for them. So we're talking about folks, again, with looking at, yes, race and ethnicity, also looking at religion, looking at sexuality, looking at gender identification, looking at able-bodied people, also looking at our elderly. So again, these are things we got to be mindful of as we are providing services for our clients, consumers, and patients. So again, this entire chapter is all about some of the issues that we may come into contact with, developing our general theoretical perspective. What is it that we're going to be basing our practice on, our approach on, as we define ourselves as a helping professional? And what tools, what techniques am I going to be using as a helping professional? Be mindful, please, good people. Until you become that licensed clinical professional, you cannot give a diagnosis. You can do a complete, thorough assessment. Yes, you can, in looking at the client's environment from the micro, meso, macro perspective, and create a great plan for them, but you cannot give a diagnosis. Be mindful that you also have to be culturally sensitive to some of the issues that your client, consumer, or patient may be bringing to the table. Not that you need to be the master of everything, but we got to remain teachable. All right, good people. I hope all of that kind of made sense for you when we talk about looking at, again, some of the issues in theory and in practice that we may be encountering as helping professionals. All right, so there will be a discussion post for you in this week's folder, and along with the chapter quiz. All right, so if you have any questions, comments, or concerns, feel free to contact me by email or on my office phone. All right, good people. I bid you love, peace, and bacon grease.